I talk with a lot of women all over the country that say, I had my blood work done and it came back normal, even though I feel crummy. There can be two reasons for this. One, in the traditional medical model, not enough markers are performed to determine which of over 22 biochemical markers are impacting your thyroid. That's right, there are over 22 pathways modulating your thyroid. Second, with the advent of managed care, your numbers are being compared to expanded reference ranges before they are flagged. I like to compare your lab numbers to what they were in this country for over 50 years prior to managed care. I'm Dr. Joni LeBay. I'm a functional health thyroid expert and fellow Hashimoto's kid in remission. And if you are contending with hypothyroid, Hashimoto's, or hormone imbalances of any kind, you need to know what is the root cause. What of these 22 pathways are impacting your thyroid, and science based, timely, sustainable protocols you can implement to start feeling like the best version of yourself. So, as an enrolled client in our ThyroSisters program, I can send you to a lab in your hometown or the closest nearest city to have your blood drawn. The results are sent to me here in San Diego, and I create a specialized program from those unique results. There's no cookie cutters. We look at the different variables that are impacting your energy levels, sleep patterns, stress response, digestion, hair falling out, and how that all relates to your thyroid. We would have a totally different conversation if you have Hashimoto's versus what I call plain vanilla low thyroid. And some of the things we'll learn from those results are whether you have inflammation going on in your body, what could be contributing to the brain fog and stubborn weight gain. If you have a parasitic or bacterial or infection or fatty liver, or do you have deficiencies in magnesium, iron? So we learn all these things, pull this together. I like you to sit back and relax when I go over these things on our first consultation. I create a functional health plan for you based off these lab results and guide you through the landmines of balancing your thyroid, adrenals, and sex hormones over the following 6 months. We connect one way or the other over through Zoom, and we're looking for progress. I want to consult with you every 5 weeks or so. You have a link to my calendar, and we're looking for progress, not perfection. But we do want to see progress every month and a half or so. If we hit a snag, we want to be on that quickly. And if there's good news to celebrate, we want to celebrate that as well. Because every successful journey needs a good map, and we need that data to ensure you will reach your destination. And conventional medicine typically focuses on just one aspect of that journey. The testing is narrow in scope and focuses on specific symptoms. In other words, not the most holistic approach to health and wellness. In contrast, functional lab testing has the ability to look at the entire body. That's because our health isn't a collection of sliced processes, but rather a complex network. And with functional lab testing, a treatment plan is comprehensive instead of merely focusing on getting rid of one symptom. Just as the name implies, functional lab testing aims to determine how your body is functioning as a unit. You might know intuitively this just isn't you, but you're being told everything's normal. Functional health testing will give us insight into why that's happening. Some of the examples of the tests you can access through our programs are comprehensive blood tests, seldom performed in the regular medical model, saliva tests to determine a circadian rhythm, meaning from morning till night, how are your hormones fluctuating? Sex hormones, adrenal hormones, thyroid hormones. Stool samples to determine pathogens, parasites, and the status of the microbiome or the bacteria of your gut. Urine samples, hormone tests, for testosterone, estrogen, progesterone. So the data gathered through these tests helps to determine the impact of the nutrition protocols that have been implemented, the stress, environment, hormones, genetics that are impacting your body. And as a result, we have more information to determine the underlying cause of any health issues, which tells us a huge story about why and what it's going to take to turn things around. In other words, a plan. So, if you're tired of having your health concerns dismissed due to conventional tests coming back in the normal range, and being told everything's normal, and you know, this just could be depression or other things that just don't resonate with you, let's dive deeper. I'm here to help. Give me a call and schedule a clarity call with me to see if you're a candidate for functional testing. We'll look into your history, your goals. I really want to know where you've been, where you're going, and uh, what your hopes and dreams and goals are. So you are talented and you're stronger than you realize and capable. You have gifts and talents, and this world needs them. And I am just looking forward to chatting with you to see if there's a way that we can help you retain the best version of yourself. So look forward to my next video where we're going to be talking about some of these functional tests in depth and how they might be able to help you.